Your loved one is coming home with a tracheostomy, and you're terrified. If you're hearing those words, that's a completely normal reaction. It's overwhelming, it's scary, and it's totally okay to feel that way. You're being handed a huge new responsibility. But here's the thing, you don't have to stay in that place of fear. The whole point of this guide is to give you, the caregiver, a clear path forward. We're going to help you turn that fear into confidence. So let's get right into it. Hi, we're Focus Family Care, and we're here to be your expert partner through all of this. We work with families all over Palm Beach County and South Florida who are in your exact shoes. If you need help right away, you can call us at 561-693-1131 or find us online at focusfamilycare.com. Okay, so here's our game plan. We're going to cover 5 key things. First, just understanding the tracheostomy itself. Then we'll get into your daily care routine. After that, we'll talk about handling urgent situations. We'll also cover skilled nursing at home, and finally, how to get all this care covered. All right, first up, understanding the tracheostomy. Let's break down what it is and why it's needed. Before we get into the how-tos, it's really important to get the what and why straight. This is our foundation. So, what exactly is a tracheostomy? You'll hear it called a trach for short. And really, it's pretty straightforward. It's a small opening that's made in the neck right into the windpipe, or trachea. Then a tube is placed in that opening, and it just makes breathing a whole lot easier. But why would someone need a trach in the first place? Well, it usually comes down to a few common reasons. Things like a serious lung or airway disease, or maybe a neurologic condition that's made the breathing muscles weak. Sometimes it's because someone needs to be on a ventilator for a long time. And in some cases, especially with kids, it's because of structural issues in the airway itself. Okay, let's now on to your daily care routine. This is where we build a predictable, safe rhythm at home. Because knowing what a trach is one thing, but living with it day to day is something else entirely. Our goal is to make it feel manageable, not chaotic. When you break it down, your daily care really comes down to 5 main things. First, suctioning. That's just to clear out mucus. Second, sight and skin care around the trach to keep it clean and prevent infection. Third, changing the ties that hold the tube in place. Fourth, using humidification, which helps keep things from getting too thick. And finally, just checking your equipment to make sure everything's ready to go. I promise, with a little practice, this all becomes second nature. All right, now for the section that's probably on your mind the most, handling urgent situations. Let's talk about building your plan for the what-if moments, because having a plan is everything. The most important thing here is learning how to recognize problems early. You are the expert on your loved one. So you'll be taught to watch for key signs, like if their breathing seems harder, or you notice changes in their skin color. Maybe it looks pale, or even a little gray or blue. You'll also look for changes in secretions, a fever, or even just a shift in their behavior, like being extra sleepy or irritable. Think of these as your early warning system. But what if something does go wrong, right? This is the question that probably keeps you up at night. And listen, here is the most important thing I can tell you. You will not go home unprepared. That's a promise. You will leave the hospital with a clear, written emergency plan, and you will physically practice what to do before your loved one ever comes home. You'll run through the drills. Okay, let's look at the 2 most common emergencies you'll prepare for. On one side, you have a blocked trach, usually from a mucus plug. The signs are pretty clear: sudden trouble breathing, maybe some high-pitched sounds. Your first move, try suctioning and follow your emergency plan, which might include changing a part called the inner cannula and calling 911 if breathing doesn't get better fast. On the other side, what if the trach comes out completely? While the sign is obvious, the tube isn't where it should be. The key here is to stay calm, try to replace it with a spare, and call 911 right away if your loved one is in distress. You'll get hands-on training for both of these. So, you might be thinking, how am I supposed to manage all of this? And the answer is simple. You're not supposed to do it alone. That's why we need to talk about skilled nursing at home. You are not alone in this. Here at Focus Family Care, our skilled nurses are absolutely central to keeping your loved ones safe and supported at home. They're the ones who bring the clinical expertise right to your doorstep, giving you the backup you need. So, what does a home health nurse actually do? Well, a whole lot. They're doing comprehensive respiratory checkups, handling both routine and emergency trach care, and managing any equipment like ventilators or oxygen. They also perform the scheduled trach changes. And maybe most importantly, their job is to keep teaching and empowering you, updating your family's care plan as things change.
Okay, but let's talk about the practical side of things. The question every family has: how do we pay for all this? Let's quickly go over how you can get this care covered through Medicare and Medicaid.
The good news is both Medicare and Medicaid can help cover this. Generally, Medicare will cover part-time or intermittent skilled nursing care for a trach, as long as it's ordered by a doctor as medically necessary. Medicaid can also cover home health, and for patients with really complex needs, it might even cover more extended hours of nursing.
But let's be honest, navigating all that paperwork can be a real headache. And that's exactly where an agency like ours comes in. We do the heavy lifting. We help gather all the documentation from the doctors, we deal with the prior authorizations, we figure out how many nursing hours you can get, and we're constantly reevaluating to make sure the plan still fits your needs.
So let's bring it all back home. The main takeaway is this: you absolutely can do this. With the right teaching, a solid plan, and skilled support by your side, families just like you are safely caring for loved ones with tracheostomies every single day. It's possible. So, if you're ready to take that first step from feeling scared to feeling confident, we are here for you. The next step is simple. Contact Focus Family Care and we can set up a no-obligation assessment to talk about your family's specific needs.
Just give us a call at Focus Family Care. The number is 561-693-1311. Again, that's 561-693-1311. Or you can find everything you need on our website at focusfamilycare.com. Remember, you don't have to figure this out on your own.